All right, so first of all, thank you for viewing this free lecture slash training of video on the topic of should you take steroids. Now, before I get started, I'm not encouraging the use of steroids in any possible way. This is solely for entertainment and educational purposes only. There was a medical disclaimer in the start of this video, and I'm just going to repeat myself. Whatever is covered in this video is in no ways meant to replace the advice from a physician or professional doctor. If you're thinking of doing anything, it makes more sense for you to consult a physician before you get started. Now, you might be wondering, why am I wearing these red color glasses? Well, it's the night time, and I usually work on the computer for long hours because I'm an online coach. And when the sun goes down, I protect my eyes and my sleep by blocking out the blue light, because when the blue light combines itself with the red color frames, the blue light is blocked and your sleep is protected. Again, this is not really a foolproof solution, but yeah, let's get started. In today's video, I'm going to be covering the topic of should you be taking steroids. Now, this is in the form of a video, and it's also going to be published in the form of a podcast, but I've just made these notes for my purposes only, so that I can demonstrate the points to you guys. So yeah, first things first, should you take steroids? Now, I'm a firm believer that if you consume any substance, you are a grown-up and you should be wise enough to make your own decisions. But before you make any decisions, you need to consider the pros and the cons of whatever you're doing. Whether you're taking drugs, whether you're hopping on a fitness journey, whether you're joining a gym, whether you're purchasing a car, you need to consider the ins and outs, all right? Now, first things first, a lot of people think that if they take steroids, they will probably look like Ronnie Coleman, or they will probably look like their favorite fitness model. Nothing could be further away from the truth. So let's get started. Should you take steroids? The answer is it depends. You need to decide for yourself. And this podcast / video is me covering the topic on what are the factors that you need to consider when deciding for yourself, basically. Now, when people say steroids, they just think, ooh, it's injection, it's this, it's like a pill, or all of that, But today's podcast and today's video is going to be an educational one. Now, when people say steroids, most likely they mean something known as androgenic anabolic steroids, basically. What are androgens? Androgens are hormones produced by your body that give you the basic sexual characteristics. Let's probably say, as a dude, as a man, you produce a lot of testosterone, which gives you more facial hair growth, which gives you more muscular growth, which actually helps you stay lean, which gives you erections, which gives you the mental clarity, the ambition, the drive, etc. You produce dihydrotestosterone, which I mentioned it in short as DHT. DHT is the more potent version of testosterone, basically. There's estrogen, which is a female hormone, which gives the more feminine characteristics. It protects your heart, it protects your brain, it helps you with more fat loss, And so when people say, ooh, you're taking steroids, what do they mean by that? Is they are talking about in reference to anabolic androgenic steroids, which are simple, they are like bioidentical versions of the hormones that you produce within your body. They could be exactly like the hormones that you produce in the body, or they could be derivatives of it, basically. Now, these days, people also take something known as peptides, growth hormone, things like that. And then there are stimulants which actually help with fat loss as well. Caffeine, nicotine, let me just add in yohimbine, Clen, etc. But now, a lot of people think that if they take anabolic androgenic steroids, if they take steroids, basically, generic term of steroids, they are going to look like a bodybuilder. They are going to simply torch the fat away. They are simply going to be putting on heaps of muscle without doing anything, right? That is so stupid, right? Steroids don't work if you don't work, as simple as that, all right? Now, androgenic steroids, the bioidentical versions of the hormones that you produce in the body, basically, or derivatives of it, they help you with muscle growth. Yes, they sure as hell help you with muscle growth, basically. But there are three categories of it. There's testosterone, there's a testosterone derivative, there's a DHT derivative, and there's a 19-nor basically. You don't need to be considered, but you don't need to be considering that. But there's testosterone. All right, testosterone is like the mother of all hormones basically. From testosterone you get DHT, you know. So testosterone, let's probably say you produce a normal basic physiological amount of testosterone in your body. That some of it is going to be converted to DHT, which is a more potent version of testosterone. It's involved in deepening of your voice, giving hardness to your penis erections. It's associated with increased mental clarity. It's associated with better muscle mass, facial hair growth, etc. Testosterone is also going to be converted to something known as estrogen. So you must have seen men who are at a high body fat percentage, they exude more feminine traits, like they've got like something known as gynecomastia, which is man boobs. You know, they are far more emotional, they lack mental clarity. So testosterone is also going to be converted to estrogen in the body. Now, a lot of men like to demonize estrogen, but estrogen is in fact really, really helpful for you. But excess of it, that's fucked up, you know. When you see excessive estrogen in the body, and you see, that's when most of the side effects like man boobs, lack of libido, etc. come inside the picture. So when bodybuilders take steroids, basically, they usually take compounds which are either derivatives of testosterone, or they're derivatives of DHT, or they're derivatives of 19-nor basically. So testosterone can be converted to DHT and can be converted to estrogen, right? Some people have high estrogenic issues. When they take testosterone, a lot of it is going to be converted to estrogen, and then that's when they get side effects like man boobs and all of those negative side effects, you know. That's when people take something known as DHT derivatives basically. Now, DHT derivatives like primobolan, masteron, etc., these are not going to be converted to estrogen. You know, these don't aromatize basically. So like that, you don't need to be concerned with this, but this is just me educating y'all. So let's probably say if you find a bodybuilder who takes testosterone, but a lot of it is converted to estrogen, in order to mitigate those negative side effects associated with excessive estrogen, he might probably reduce the dosage of his testosterone, and he might probably increase the dosage of his DHT derivatives from one of the compounds that I just mentioned. Then we got something known as 19-nor. Now, 19-nor is like, it comes from testosterone, but it doesn't convert to estrogen. It doesn't convert to DHT. It's just like testosterone basically. That's the best way to put it. So each of these, like testosterone, DHT, and 19-nors, each of these have different types of compounds associated with it. I'm not going to dwell into the video. I'm not going to dwell into the different types of these compounds, but yep. So when bodybuilders say, like when people say, "Ooh, I need to be taking steroids," they usually talk about androgens, okay? Things like peptides, growth hormone. Growth hormone simply increases the size of every cell inside your body, basically, literally every cell, good or bad. Let's probably say you got a lot of cancer cells. It's going to increase the number of cancers. It's going to like increase the growth of the cancer cells inside your body, you know? So if you just take growth hormone, basically, it's not going to do anything from a muscle building perspective. Yes, it might help you with good skin, good hair, good nails, from a little bit of an anti-aging perspective, but if used in isolation, it's not going to do anything, right? So, but a lot of bodybuilders, they take anabolic androgenic steroids, okay, and they take it in combination with something known as growth hormone. So growth hormone is going to like increase the receptor size, so that the hormone, the exogenous hormone that you're injecting inside your body in the form of anabolic androgenic steroids, will act on a larger receptor, and the action of those anabolic androgenic hormones that you're injecting inside your body is probably going to be more, you know. So second, fat loss drugs, basically, these are not steroids, okay, but they just simply they just simply stimulate you. So let's probably say if you have caffeine, you feel energetic and you will move more, and your caloric expenditure is going to be more. When you burn more calories, you're simply going to cause more fat loss. As simple as that. Nicotine is one of them. For those of y'all who smoke, who vape, you all might have noticed that when y'all smoke excessively or when y'all vape excessively, you all feel like eating less. Now, this is not really the best way to lose body fat, but it's not the cigarette which is causing you to eat. Like, it's not the cigarette, it's not the nicotine inside the cigarette which is making you drop the body fat. It's the effects created by the nicotine, which has a slight hunger suppressing effect, which makes you eat less, which makes you reduce your calories, because of which you are simply dropping body fat. Then there are things like yohimbine, clenbuterol, and things like that. For those of y'all who are pretty active in the bodybuilding circles, a lot of bodybuilders take things like yohimbine and clenbuterol. Basically, what this simply does is, it's a stimulant. You know, it works like caffeine. It mobilizes the fat cells from your body. So like the trapped fat cells, it just puts it in the bloodstream. Now they've been mobilized, but now you want to oxidize it. In order for you to oxidize it, you need to release those fat cells. How do you release it? Some form of activity like jogging, walking, etc. So what do I mean by this is, you still got to do the fucking work, you know? So how do anabolic androgenic steroids actually work? Let's probably say you inject a dose of testosterone inside your body, more than physiological levels, more than what you normally produce. What's going to happen is you got more of that floating around your bloodstream, and they're going to bind to the receptors on your muscle cells, and boom, the muscle cells are going to be far more sensitive to nutrient uptake. There's going to be more fluid sucked inside the muscle cells. There's going to be more nutrients sucked inside the muscle cells, as a result of which your strength in the gym is going to go more, provided that you do train, and boom, your progression is going to be more, and boom, you're going to put on muscle. That's just an oversimplified way for me to explain things to you, but steroids don't work if you don't work. I'm just going to say this, all right? Now, first things first. I'm not going to say steroids are bad. I'm not going to say they're good. I'm just going to note down the pros and the cons, all right? Side effects, all right? Males have different side effects. Females have different side effects. Females are literally 30 more times sensitive to anabolic androgenic steroids, because females don't produce male hormones in the way that, like in the amount that males actually do. Let's probably say an average female produces like 30 nanograms per deciliter of testosterone. An average male produces something like anywhere between 300 to 1,000 nanograms per deciliter of testosterone, basically. Men produce 30 times more, you know? So females, if they take a little bit, boom, like the effects will be like crazy, basically. But the side effects will be pretty hard as well. Whereas males, they have a high tolerance basically towards using anabolic androgenic steroids, basically. So yeah, side effects, males and females, steroids have side effects. Okay, steroids have side effects, as simple as that. Second is genetics. The people who reach Mr. Olympia, top of the stage basically, they've got like a higher tolerance, like side effect tolerance ratio to anabolic androgenic steroids and the different compounds and the drugs that they put in their body compared to the average Joe. There's a huge genetic factor associated with it, because of which they can take vast amounts of drugs and still be the best in the world, and still come off it years later without a detrimental effect to their health. Some people, they just take a little bit and the side effects are like crazy. Some people take a moderate dose and the side effects are okay, and they can tolerate it. Some people take like a high dose and they don't feel anything, basically. So the side effect profile of steroids is highly individualized. But let me start off with, I've already covered the topic of response rate. You know, some people just take a little bit and boom, they blow up. Some people need to take a bit more, like a moderate dose, and that's when they start blowing up. Some people need to take a lot, and that's when they start blowing up. Some people take a lot and they don't change at all. I met some people like that, you know. It's shit, it sucks, right? So the response rate is highly genetic as well. But it also comes down to your work ethic, which I'm going to be covering later as well. Now, let me just cover a few of the side effects, basically. Now, there are several side effects, but brain health. Now, these days, like a lot of 16-year-olds, 18-year-old kids are watching TikTok videos, and they're taking trenbolone, which is a compound given to horses, basically. You know, it's like a form of testosterone given to horses. You know, incredibly powerful, but like your brain is a tissue which is it's always developing. Like there's tons of research which shows that your brain will continue to develop all the way till the end of your life basically, but it usually reaches its peak at the age of 25. So there are like different sides to the brain. There's a prefrontal cortex basically, which is the most executive center of the brain, which is involved in making rational decisions. It's involved in making objective decisions. It keeps you logical, it keeps you calm, it keeps you calculated, collected. So when you take things like anabolic androgenic steroids, yeah, you probably get a bit more primitive, and the amygdala, which is involved in feeding, fighting, fucking, the most primitive part of your brain, that fires up a little bit more, and the prefrontal cortex, that area of the brain, will shrink a little bit more. So there's tons of research which shows that anabolic androgenic steroids basically, not peptides, not stimulants, but anabolic androgenic steroids, they actually shrink some parts of your brain, especially the parts in the prefrontal cortex. So you must have seen like those meatheads in the gym, that stereotype, like all muscle, no brains. It's sort of true, you know? So the brain health, you need to consider, are you fully mature? Are you like mentally mature basically? Are you like, how old are you? Are you 25? You know, have you reached your full potential basically? So yeah, it's going to reduce your IQ. There's tons of research which shows that using steroids will reduce your IQ. The second thing is sexual health. When you first start taking steroids and when you continue taking steroids, your sex drive is going to be high, like, because you are injecting sexual hormones basically. So for some people, it's like an increased desire to have sex basically. For females, they have an increased desire of having sex, not like cuddling, connecting and all of that, but from a place of I just want to do the deed and that's it, like just like how dudes think basically. So yes, it's going to improve your sexual health, perhaps to the point where it's detrimental, but the thing is, when you come off it, a lot of people face erectile dysfunction. They can't get it up, you know? When you're using certain compounds like DECA, which is one of the derivatives from the anabolic androgenic steroids basically, you get something known as DECA dick. Like your libido is insanely high, but you can't get it up. Pretty shit, right? Again, some people might face it, some people might not really face it, but there are some compounds which negatively affect your sexual health, and there are some compounds which positively affect your sexual health. And there are some people who just take a little bit and they get like sexual side effects basically. That's the second thing. Third thing is mental health. Right. Now there's this saying, like a lot of people ask other bodybuilders, how do you feel on steroids basically? So the thing about steroids is they will just simply magnify those traits which you already have. So let's probably say you are normally like an aggressive guy or a girl. If you take steroids, it's probably going to be more. If you're a pretty calm or a chill out guy, you'll probably become a bit more slightly extroverted. You'll talk a little bit more. Obviously, you're not going to get into fights, but like if you got mental health problems, perhaps you need to sort that out before you even think about injecting anything inside your body. You know, fertility. So for men, they produce most of their testosterone within their testicles, their balls basically, right? And most of the spermatozoa, the sperms basically, is produced within the balls. So when you take testosterone, again, this might be genetic, but in a lot of cases, you shut down your own internal testicular function because the body's like, ooh, I'm already getting testosterone from outside, so why should I produce my own testosterone? That's when your sperm count goes down to close to zero in some cases. Your own internal testosterone production shuts down. So when you do come off it, in some cases, some people lose their fertility forever. In some cases, people get it back. In some cases, people are still fertile whilst they're on steroids. Again, there's a huge genetic component associated with it. But fertility tends to be affected. For females, let's probably say if they are abusing steroids, they take a high dose of testosterone because they want to compete in a bodybuilding show. females are not made to produce that much testosterone, and they are basically changing their physiology from that of a woman to that of a man, and they begin to emit more transgender traits basically, and hence their fertility might be affected. Again, there's a huge genetic component associated with it as well. Hair, you know, if you're predisposed to getting bald and you take anabolic androgenic steroids, you will become bald. You know, that's one of the main reasons as to why I'm not taking anything, although I'm really tempted sometimes. But my hair is more important to me, as a result of which I was like, I'm going to stay as natural as possible because my hair is really important. For females, they take anabolic androgenic steroids. You are simply changing the physiology of that woman from that of a woman to that of a man. So she's going to exude more masculine traits. Hair loss is one of them. Facial hair growth is one of them. You know, cardiac risk. Steroids. Anabolic androgenic steroids simply thicken the quality of your blood, as a result of which they increase the blood pressure, and the risk for heart attacks, etc., is going to be way more. So if you have a history of heart diseases, cardiac diseases, cholesterol, blood pressure, etc. in your family, it's better to stay away from it. You know, yes, obviously there are like a few ways to avoid it by doing your cardio so that you keep your heart health healthy, but it's better to stay clear from it. Things like growth hormone, obviously it's not an anabolic androgenic steroid. It simply increases the size of your heart as well, which is not great. Third, rage. I'll cover this, but this is like a byproduct of mental health and brain health basically. So steroids basically increase the amygdala, which is they don't increase the amygdala, but they shrink the prefrontal cortex, and the actions of the amygdala will probably be higher, as a result of which you're gonna have like anger issues if you are not a calm and collected person, if you don't really know how to manage your emotional well-being. So yeah, virilization. What is virilization? This is just a fancier way for using the term masculinization. I don't know if you must have noticed, but female bodybuilders on top of the Olympia stage, they exude more dude-like characteristics. They got like a deeper voice. They got an enlarged clitoris basically. In case if you look at the shape of a clitoris, it looks like that of a penis basically, like a small penis basically. If you inject more anabolic androgenic steroids inside the female body, eventually the clitoris is gonna grow, and you're almost reaching up to the point where it's borderline gender change sort of a thing. So virilization, females are at the highest risk for this. Hair loss, acne, deepening of the voice, you know, like the facial structure looks a bit more masculine, and you just take the femininity away from the woman, which is not that great, you know. So these are the side effects that you need to be considering basically. Again, it's highly genetical, you know, but the bodybuilders abuse it. Now these drugs, do know that they were used by doctors to combat problems. There's something known as TRT and HRT. What is TRT? Testosterone replacement therapy. And what is HRT? Hormone replacement therapy. So testosterone replacement therapy is used usually by doctors to restore the normal testosterone function in men basically. So this term known as hypogonadism basically. This is where a normal man, where a man produces lesser than the range of the normal testosterone produced by a healthy man. So he feels depressed, he doesn't feel motivated, that drive is not there, he doesn't feel like having sex, he finds it really hard to put on muscle, puts on fat like easily. So in those cases, doctors are gonna like inject external testosterone to put him back in the normal physiological range to restore healthy function of the man. A lot of clinics do this, endocrinologists do this. In this case, you know, you're using steroids for your benefit, you're not abusing it. Bodybuilders abuse it basically. Hormone replacement therapy. Now females usually use hormone replacement therapy because when they hit menopause, they shut down their own estrogen production inside the body. The beginning of menopause usually starts anywhere between the ages of 43 up until 50s and 60s. Usually the amount of eggs that women begin to produce diminishes a bit. The amount of hormones that women begin to produce diminishes from the age of 43 onwards. So hormone replacement therapy, which is like taking exogenous means external, exogenous estrogen, to restore their normal function and improve their quality of life, is also helpful as well. A lot of women shy away from it, but this is actually really, really helpful. So let's probably say you get your basic blood work done and you realize like your hormones are not really on point. The first possible thing that I usually suggest to everybody is, again, I don't prescribe anybody anything around anabolic androgenic steroids or any of these compounds, but I usually go like, let's fix your sleep, let's fix your nutrient intake, let's fix your supplementation, let's fix your eating, let's fix your movement, let's fix your exercise, let's fix your hydration. So many other variables basically, and then it makes most sense for you to take things under the guidance of a doctor if things are still not back to normal basically. So yeah, these are the only two situations that a normal person needs to consider when it comes to taking anything, and this should solely be done under the guidance of a doctor after the basics have been nailed. But most of the people are too dumb to do that shit basically, because they're lazy. Most of the people love quick fixes, but that's not how it works. Tons of other supplements. Let's probably say if you're on TRT, if you're on HRT, or even if you're abusing steroids as a bodybuilder, you need tons of supplements. Fish oil, magnesium, zinc, curcumin, because you are pushing something up above the normal ranges, so you need something else to mitigate the side effects, to mitigate those things which might be elevated as a byproduct of you injecting an exogenous substance inside your body. So things like GABA, which helps you calm down if you are taking testosterone and you tend to feel angry. Things like melatonin, etc. So you need to like really, really be on top of your supplementation and your nutrition. You need to be sleeping on time. Otherwise, if you take steroids while you are partying every day, you're drinking alcohol 3 out of 7 days in a week, it's not going to work. In fact, it's going to have like detrimental side effects to you, and that's a recipe for an early death, as simple as that. So you really need to take like tons of other supplements to take care of your health. But you're going to ask me right now, when should you take it? So to a normal person, I'd suggest don't even take it. To a bodybuilder or a competitor, like I'd say, is your sleep in check? Have you been progressively training inside the gym where you're tracking your weights and reps for at least 10 years? Are you on track with your nutrition properly for at least 5 to 10 years basically? Are you tracking all the variables, and do you have a firm base of being natural? If you have all of this and you want to compete at the highest level possible, because at the highest level possible everybody's taking it, then it makes most sense for you to start off with the bare minimum dosage. And I'm not going to say what is the bare minimum dosage, but you want to have your shit nailed in before you take anything. So yeah, people, if you found this useful, feel free to subscribe to my channel. Feel free to like, share, follow my podcast on whichever platform you're watching, seeing this, and stay tuned for more. Thank you for viewing and have a nice one.